Hi, this is Chris Shear. Welcome back to Chapter 2 of Basic EKG Interpretation for Healthcare Providers. I'm going to talk to you a little bit about cardiac anatomy, physiology, and electrophysiology, and that'll set us up for success getting into Chapter 3, where we actually get into graph paper and the PQRST complex and what those waveforms actually mean. So, very quickly, going over the layers of the heart, you have the endocardium, that is the inside of the chambers of the heart. And endo means within, comes from Latin. You have myocardium, which is the muscular layer of the heart. That is where the force is generated to actually push the blood out into the system. Your epicardium comes from on or over, and don't get that confused with pericardium. So you have the outside of the heart, and then you have a layer of fibrous tissue that surrounds the heart. And the pericardium has a couple of functions. Of protection is one of them, but it also secretes serous fluid that allows the heart to expand and contract without generating friction under normal circumstances. If a person has inflammation or something's going wrong, you might hear what's called a pericardial friction rub, and that can be painful. All right, so moving on to the properties of the heart. First one is automaticity. The heart is a very interesting organ in that it does not require the brain to beat, right? So it's kind of important, right? We don't want to have to think about our heart beating. It just happens. And moving on to the next one is excitability. That's the ability of the cardiac cells to respond when they receive this stimulus. All right, and then you have conductivity, which is the ability of those cardiac cells to transmit the message from one cardiac cell to another. And contractility is the shortening, which is a property that is shared with skeletal muscle tissue and smooth muscle tissue as well. That's when those actin and myosin filaments come together, and that allows the muscle to get shorter and push the blood out into the system. So make sure you're familiar with those terms, and then we're going to go over very quickly the chambers, valves, and blood flow. So know that there are four chambers of the heart. You see an abstract image here. You see that square in the middle showing the four chambers of the heart. The right atria and right ventricle on the right side of the heart, that is where deoxygenated blood is carried. It's brought back in from the systemic tissues and pushed up into the lungs so that the body can get rid of carbon dioxide, the waste product of metabolism, and bring in some more oxygen. And that oxygenated blood goes back into the left side of the heart, into the left atria, and into the left ventricle, and then out through the system. So now you see a less abstract picture. This actually looks like a heart. All right, and it shows the pathway of blood flow. I encourage you to memorize how a drop of blood flows through the heart. If you understand what is happening normally, it'll make it a lot easier for you to understand what is occurring when things go wrong. All right. Want to point out real quick, you can see a couple of terms down there at the bottom left of the screen. You can see tricuspid and mitral, sometimes known as the bicuspid valve. So the tricuspid valve, if I use my pointer, you can kind of see it is where blood flows from the right atria to the right ventricle. This would be the tricuspid valve, and then your bicuspid valve is over here where the left atria, it's identified as the left atrioventricular valve on the screen. Just point that out because it's more common in um, nursing and paramedic textbooks to refer to them as tricuspid and mitral. So anyways, understand that when those valves are not working correctly, or if the heart is pathologically thickened, or if the heart is just weak, sometimes blood will regurgitate and flow back in the wrong direction for a lot of different reasons. That's why it's important for you to understand very much in detail how blood flows through the heart normally. It'll to help you to understand the signs and symptoms and complaints of your patients if you're able to pick up on uh, situations where the blood is not flowing correctly. So moving on to the conduction system. So what we're looking at right here is an abstract drawing of the heart's conductive system, and understand that this tissue does not result in a contraction of the heart. It creates the electrical stimulus for that to happen. The conductive system makes up around 1% of the heart's mass. So this is very small, takes up a very, very small amount of space in the heart. But without it, the heart can't beat. So it's critical. The sinus node right up there at the top is, under normal circumstances, that is the pacemaker of the heart. Okay, so the heart generates, through automaticity, the heart generates what's known as an action potential, and then that stimulus travels through this network over to the left atria and down what are called internodal pathways to the AV node, or atrioventricular node. It makes sense. The AV node, the atrioventricular node, it's kind of like where the top and the bottom of the heart are separated. So that stimulus goes through this AV node and bundle of His, and there's a very slight delay here, but it's deliberate in the design of the conductive system. The delay allows the blood from the atria to get kicked from the top to the bottom, and those ventricles can fill a little bit more efficiently, so that when the ventricles do contract, they push an adequate amount of blood out to the heart. And again, that's if the heart is working the way that it's supposed to. Okay, then you have the left bundle branch and the right bundle branch. These are branches that receive the stimulus and send the stimulus down into the Purkinje fibers. So if the conductive system is working normally, we see the shapes on the monitor, on the EKG, and when we print out the graph paper, we can see those images and identify the different areas of the conduction system on the graph paper, right? So that's really the whole purpose of us interpreting electrocardiograms, is to get an idea of what's going on in this system, because we can tell if something is going wrong from an electrical standpoint. Is the sinus node not firing? We can see that. Is a stimulus being generated from somewhere in the bottom of the heart or the middle of the heart? We can tell. Is there a block? Is there a delay? Is there something causing the conduction system to not function with its inherent design? These are all things that we can interpret by looking at the electrocardiogram. So we're going to stop there, and I will see you in chapter 3 when we go over graph paper and the complexes and waveforms.